Hi coding team, this is Dr. T. Today we're going to be talking few words related to cardiac infarct. As you can see here in our image, in our book, column to the left, we have infarct as in infarction. I have marked this one in red dots, highlighted, cardiac, see, infarct myocardial. Now, in this book, in the next column, what we have? Myocardial acute with a stated duration of 4 weeks or less. The traditional code I21.9. Now, just pay attention to this comment, the 4 weeks or less, I21.9. If this is going to be diagnosed as over 4 weeks, or as the book says, diagnosed on EKG, but without symptoms, that's what we call an old infarct. That's not going to be I21.9. Pay attention to the 4 weeks. So now we have I25.2, old infarct. Well, now let's return to the family of the I21.9. So what do we have in here? Again, the heel or old infarct, I25.2, back to I21.9. Now, what else do we have? I21.4. Just pay attention to this detail. Here we have I21.4 for marked in green, non-Q wave, I21.4, non-transmural, I21.4, again, non-transmural here, I21.4. Yeah. Now, we have the 121.3 Q wave. Yes. So you see the difference. This is non-transmural, non-Q wave. This is Q wave. Yeah, I21.4 versus I21.3. Now we have a big classification, but today we're going to be talking about the most important ones, the family of the acute infarct, I21.9. Now for this one, we have another classification. The type 1, type 2, type 3, type 4, type 5. Yeah? So, you see this one repeated in here. Type 1, type 2, type 3, type 4, type 5. Yeah? Again here, the I21.9. Okay, let's gonna start talking type 1.9. Let's gonna be talking about this classification. Type 1. Yeah? See also infarction, myocardial, subsequent by side or by ST elevation. Basically, this type 1, you see here I have documented the coronary plaque. Yeah? Basically, that's the issue. These type 1s are the ones coronary plaque. Now, we have the type 2. In the type 2, or I21.A1, these are not going to be related to a coronary plaque. This is going to be related to this balance between the offer and the demand. The offer, the supply of oxygen, versus the heart that is going to be very demanding due to some extraneous circumstances. No? So this type 2 or I21.A1 not going to be related to a coronary plaque. This is going to be related to a disbalance. Now we have the type 3. The type 3 are a different story. This is going to be confirmed by the autopsy. Yeah, that's a tragical situation. So this is going to be related to a condition when the patient died before any biological sample, any biological marker was obtained from the patient. So basically the final diagnosis is obtained in the autopsy. Yeah. So now we have the type 4 and the type 5. Yeah. Type 4 related to procedures. Which procedures? Percutaneous coronary intervention. Yeah. That's going to be either a thrombosis in the stent or restenosis, all those related to procedure percutaneous PCI, yeah, coronary intervention. Now, we have also the type 5, also related to procedure, but that's not going to be a PCI, that's going to be a CABG, yeah, the coronary artery bypass graft. You see? So, we have the traditional one, the I21.9. Now we need to make the difference with the old healed infarct, I25.2. We have the I21.3 Q wave or transmural, the I-21.4, non-Q wave, non-transmural, yeah, and the subclassification related to the type 1 coronary plaque, type 2 the disbalance, type 3 which diagnosed obtained in the autopsy, the type 4 related to the PCI, and the type 5 related to the CABG, the coronary artery bypass graft. I'm preparing an infography related to all this one, and of course, classification for this myocardial infarct is abundant, tons of codes. We'll continue talking about this one. Hey, take care, coding team. See you. Bye.